So BRD is bovine respiratory disease. People might be familiar with bronchopneumonia. That's one manifestation of respiratory disease in cattle. Also there's pericarditis, lung abscess and pleurisy. All of these are manifestations of bovine respiratory disease. BRD is the most common cause of infectious disease and the most common ailment that we actually treat in the feedlot. It can cause illness, but can also cause death. The other things that it can cause in a subclinical sense are actually loss of productivity and lung lesions at slaughter. BRD is a syndrome of viral and bacterial infections in the chest. The viruses are contracted from other cattle or from other sources of origin in the feedlot in close commingling. The bacterial infection of the chest actually comes about after a range of stress factors that have been endured by the cattle adapting to the feedlot, disarms their local and more wider immune response in their respiratory tract, translocate to the lungs and set up infection there. This is bronchopneumonia. This is what the manifestation of BRD. There are some clinical signs that are more consistent with BRD if a feeder animal is under observation, but noting that there's a spectrum of these signs from mild to moderate to severe depending on the disease stage. The most reliable set of signs are associated with depression, as lung infection causes whole body fever, reduces oxygen exchange and spreads bacteria through the body via the bloodstream. A normal, bright, alert, responsive and attentive animal transforms into an animal with a sleepy and heavy hunched demeanour and posture. They lack normal purpose and prey animal attentiveness, and they potentially even attempt to hide from the observer. With experience and practice and observation, these animals can be differentiated quite consistently against their normal healthy pen mates. It's important to note that clinical signs of nasal discharges, respiration rate, flank fill, salivation, hair coat characteristics, etc. are actually not reliable indicators of the classic BRD. Some BRD infections in the feedlot are quite acute and short term and are cleared very quickly, whereas others develop into a chronic illness, and these are usually associated with lung lesions that are present at slaughter. As lung lesions are present at slaughter, if they're significant enough, are often associated with lower carcass weights and less productivity overall.
NH Foods has partnered with Meat Livestock Australia to produce a series of short, informative videos focusing on animal health. The aim of these videos is to show a link between improved animal health and increased on-farm profitability. To access your animal's health data, visit the My Feedback website.